Hey everyone, welcome back to the Deep Dive. Today we're diving into a topic that hits close to home for a lot of us, especially those who've been pushing their limits for a while now. Shoulder injuries in aging athletes.
Yeah, it's interesting because it's not just about the wear and tear you accumulate over the years. The aging athlete's shoulder, it presents some pretty unique challenges. Everything from the types of injuries we see to how we approach treatment and recovery.
Absolutely. And our listener today is all about getting back in the game after a shoulder injury. They've sent over a whole stack of medical texts, diagrams, research papers. We're talking the works. So we're going to dive deep into SLAP tears, dislocations, those pesky rotator cuff issues, AC joint separations, and even arthritis. Ready to unpack all of this.
Absolutely. It's going to be a really insightful deep dive for any athlete, especially those looking to keep playing their sport for as long as possible.
All right, let's start with those SLAP tears. What exactly are we talking about here?
So the superior labrum is this tough, fibrous rim around the shoulder socket. Think of it like a bumper that helps keep the ball of the shoulder joint nice and stable, especially when you're doing overhead movements like throwing a baseball or swimming.
And when that labrum tears, specifically at the top, right where the biceps tendon attaches, that's what we call a SLAP tear, superior labrum anterior to posterior. Our listener was kind enough to send over this diagram that shows all these different types of tears, and wow, it's not pretty.
No, it's not a fun injury. And the type of SLAP tear you have, along with your age, it really impacts how we're going to approach treatment.
So how do you go about figuring out what kind of SLAP tear someone has?
Well, a thorough evaluation is really key. We'll talk to you about your symptoms, examine your shoulder's range of motion, and do some special tests, like the O'Brien's test or the Speeds test. These tests put stress on the biceps tendon and the labrum and can really help pinpoint where the problem is. And of course, we'll likely use imaging. An MRI arthrogram is particularly helpful in these cases.
Okay, so you've diagnosed the SLAP tear. Is surgery the automatic next step?
Not necessarily. For less severe tears, we might start with conservative management, things like rest, ice, physical therapy, to strengthen those shoulder muscles and improve mechanics. The goal is to reduce pain and get you back to your activities without needing surgery.
What if those conservative measures just aren't getting the job done?
Well, then we start talking about surgical options. For younger athletes, primary repair of the labrum, essentially stitching it back together, is often the preferred choice. But for older athletes, we're seeing a shift towards biceps tenodesis or tenotomy.
Oh, no, this is where things get interesting. Tell me a bit more about those procedures.
Sure. So biceps tenodesis involves moving the attachment of the biceps tendon to a different spot on the humerus bone. This helps to relieve stress on that torn labrum. Tenotomy, on the other hand, involves actually cutting the biceps tendon.
Whoa, cutting the tendon, that sounds pretty intense.
I know it might sound a bit drastic, but studies have actually shown that for older athletes, these procedures, the tenodesis or the tenotomy, can lead to better outcomes and a faster return to their sport compared to that primary repair we talked about.
Why is that? Is it something to do with age?
Exactly. As we get older, our tissues just don't heal the same way they did when we were younger. And so tenodesis or tenotomy can offer a more reliable solution in the long run. They have lower re-tear rates.
So it's really about choosing the approach that best fits the athlete's age, their individual needs, and their goals.
Precisely. It's all about personalized care. What works for one athlete might not be the best option for another.
Now let's talk about another shoulder injury that I think sends chills down everyone's spine. Shoulder dislocations. I can just picture you're out on the field going for that ball and pop. That shoulder is out of place.
It's definitely a traumatic injury, and it tends to be a bit more complicated when we see it in older athletes.
Oh, really? How come?
Well, as we age, those rotator cuff tendons, which are super important for shoulder stability, they tend to weaken a bit. This makes them much more likely to tear when that shoulder dislocates.
So it's not just the dislocation itself, but the possibility of all these other injuries that makes it tricky in older athletes.
You got it. The rate of rotator cuff tears in patients over 40 who dislocate their shoulder is significantly higher than in their younger counterparts.
Okay, that makes sense. So how do you go about treating those more complex cases?
Well, for a first-time dislocation, we usually start with non-operative management. That basically means putting the shoulder back in place, a closed reduction, immobilizing it for a bit, and then starting a good rehab program.
So some rest, and then slowly but surely building back that strength and mobility.
Exactly. But if the dislocation keeps recurring, or if we find a significant rotator cuff tear during our evaluation, then surgery becomes much more likely.
I'm assuming the surgery in those cases is a bit more involved than just popping that shoulder back in.
You are correct. We've got to address both the labral tear, which is often contributing to that instability, and any rotator cuff damage. It's all about restoring both stability and function.
Makes sense. Now let's move on to rotator cuff impingement. Can you tell us what that is and how it affects us aging athletes?
So imagine the rotator cuff tendons getting pinched between the bones in your shoulder. That's impingement. It leads to pain, inflammation, and makes those overhead movements we were talking about earlier really tough.
Oh, I've definitely felt that pain, especially when I'm doing things like swimming or playing tennis. It feels like something's catching in there.
That's a really common way to describe it, and it's important to distinguish between primary and secondary impingement. Primary impingement is due to structural issues in the shoulder, while secondary impingement happens because of instability or weakness in the muscles surrounding the shoulder.
And I'm assuming those age-related changes we've been talking about play a role here too, right?
Yeah. Absolutely. As we get older, those rotator cuff tendons, they can wear down, which makes them more susceptible to tearing and that impingement you're talking about.
Okay, so what are the red flags here? How do you know if you might have rotator cuff impingement?
Well, the most obvious is pain, especially pain with overhead activities. You might also notice some weakness in your shoulder, stiffness, and even that clicking or catching sensation you mentioned.
So if you're experiencing those symptoms, what should you do?
The first step is to get a proper evaluation. We'll take a thorough history, do a physical exam, we'll check your range of motion, assess your strength, and perform some special tests like the Neer and Hawkins impingement test to see if we can reproduce your pain.
Ah, yes, the good old impingement test.
Yeah.
If I remember correctly, you're basically lifting the arm and applying some pressure to see if you can trigger that familiar pain, right?
You got it. And then we often turn to imaging, and MRI is usually the gold standard here, to confirm the diagnosis and see how severe the impingement or any tears might be.
All right, let's talk treatment. What are the options when it comes to rotator cuff impingement?
Just like most shoulder issues, it really depends on how severe the problem is. For mild cases, we often start with non-operative management. Rest, ice, over-the-counter pain relievers, and good old physical therapy to strengthen those rotator cuff muscles and improve your shoulder mechanics.
What about those cortisone injections I've heard about? Can those help?
They can provide short-term pain relief, that's for sure. But the use of cortisone injections is a bit controversial, especially for older adults. Some studies have shown that they don't really have much long-term benefit and might actually weaken the tendons over time.
So it's a bit of a trade-off.
Yeah.
But what if those conservative options just aren't cutting it?
Well, if those conservative measures fail to provide relief, we might start discussing surgical options. Subacromial decompression is a procedure that involves removing some bone and tissue to create more space for those rotator cuff tendons, basically relieving that pinching we talked about. And if we find a rotator cuff tear during the procedure, we'll repair that at the same time.
So it's kind of a two birds, one stone approach.
That's one way to put it. And addressing both those issues, the impingement and any tears, is really key for long-term shoulder health.
You mentioned rotator cuff repair. Are there different techniques for that? I've heard some terms thrown around, but I'm not really familiar with the specifics.
There are different techniques, and we're seeing a trend towards something called arthroscopic double row fixation these days. It basically involves using more anchors to reattach the tendon to the bone, which makes for a much stronger repair, especially for those larger tears.
And how successful are these surgical interventions for aging athletes? Are we talking about a guaranteed fix here?
Well, the research is a little mixed, especially when it comes to subacromial decompression for isolated impingement in older adults. The decision to have surgery is always made on a case-by-case basis. We've got to consider things like your specific symptoms, your activity level, your overall health, and your goals.
Makes sense. It's not a one-size-fits-all situation. And what about the timing of surgery? Does it matter if you wait or if you address it right away?
There's a growing body of evidence that suggests that early surgical intervention for those acute ruptures in aging athletes leads to better outcomes overall. So if you do experience a rotator cuff tear, don't put off seeking medical attention.
Prompt diagnosis and treatment are key.
Yes.
All right, moving on. Let's talk about AC joint separations. Can you walk us through what this injury is all about?
Sure. So the AC joint, or acromioclavicular joint, is where your collarbone, the clavicle, meets your shoulder blade, the acromion. It's held together by ligaments, and when those ligaments get injured, it can cause pain and instability.
Our listener included a diagram of the AC joint, and it's really helpful to visualize all those ligaments that are holding things together.
I agree, a picture is worth 1,000 words sometimes. And like those SLAP tears, AC joint separations are classified by severity. We use something called the Rockwood classification system.
Ah, yes, the Rockwood classification. If I remember correctly, it ranges from a type I, which is basically a sprain, all the way to a type 6, which is a complete dislocation of the joint, right?
That's right.
So if someone has a fall and lands right on their shoulder, how do you determine if they've got an AC joint separation and how bad it is?
We start with a good physical exam. We're looking for any tenderness, swelling, any obvious deformities around the AC joint. We'll check your range of motion and do some tests to assess the stability of the joint. Then, x-rays are usually the next step. They'll confirm the diagnosis and give us a better idea of the severity of the separation.
And what about treatment? Is surgery the only option?
Like with all shoulder injuries, it depends. Type I and II injuries, which involve less severe ligament damage, those are usually managed conservatively.
So we're back to the RICE protocol: rest, ice, compression, elevation, and some good old-fashioned physical therapy.
Exactly. However, for the more severe separations like a type 4, V, or 6-6, or if that conservative treatment doesn't really work for a type 3, then surgery might be recommended.
Our listener mentioned that there's some debate surrounding how to treat those type 3 injuries. Something about a lack of a gold standard approach.
That's right. There's some ongoing debate about whether surgery is always the best option for type 3 AC joint separations. Some surgeons believe that non-operative treatment can lead to good outcomes, even for those more severe injuries, while others are stronger advocates for surgical intervention.
So it's a judgment call based on the individual patient and their circumstances.
Exactly. We consider factors like the athlete's age, their activity level, and how unstable the joint is when making that decision.
Our listener also mentioned AC joint injections. What are those and what role do they play in treatment?
These injections usually contain a corticosteroid, and they can be really helpful in managing pain. They work by reducing inflammation in the joint.
So it's a way to get some pain relief and control inflammation while those ligaments are healing.
Exactly. But it's important to understand that injections don't magically cure AC joint separations.
Okay, so what about getting back to playing sports after an AC joint injury? What's the typical recovery like for aging athletes?
It can be a little bit tricky, especially for those who participate in high-demand activities. Setting realistic expectations is really important. Working closely with your doctor and physical therapist is key to ensuring a safe and effective return to your sport or activity.
All right. For our last topic in this section, let's tackle something that many aging athletes probably dread: glenohumeral arthritis.
Oh yeah, that's a tough one. This is where the cartilage in the shoulder joint starts to wear down, leading to pain, stiffness, and that limited mobility that can really keep you from doing the things you love.
I can practically hear our listeners wincing in sympathy. It just doesn't sound pleasant at all.
It can be pretty debilitating, especially for those who rely on their shoulders for their sport or active lifestyle.
So how do you go about diagnosing glenohumeral arthritis?
We start with a comprehensive evaluation, just like we do with the other shoulder issues we've talked about. We'll ask about your symptoms, your past medical history, your activity level. Then we'll do a physical exam, checking your shoulder's range of motion, strength, and looking for any signs of instability.
And I imagine imaging plays a big role here as well.
Absolutely. X-rays are usually the first step. They allow us to visualize the joint and assess how severe the arthritis is. Sometimes a CT scan is needed to get a more detailed look.
And what are you looking for in those images?
Signs of cartilage loss, bone spurs, any deformities in the joint. We also take a good look at the glenoid, which is the socket part of the shoulder joint.
Our listener mentioned something called the Walsh classification. What is that?
The Walsh classification is a system that helps us categorize the severity and the pattern of bone loss in the glenoid, and that can really guide our treatment decisions.
Okay, so let's talk treatment. What are the options when it comes to glenohumeral arthritis?
Like everything else we've discussed, it depends on the severity of the arthritis and the athlete's individual goals. For early-stage arthritis, we usually start with non-operative management.
So things like managing the pain, modifying your activities, and doing physical therapy to try and preserve as much mobility as possible.
You got it. Physical therapy is really focused on strengthening the muscles around the shoulder, improving your flexibility, and reducing your pain.
What about medications? Are there any that can help?
We might suggest over-the-counter pain relievers like ibuprofen or naproxen to help manage inflammation and pain. Sometimes, if those aren't doing enough, We might prescribe stronger medications or recommend corticosteroid injections into the joint to provide more significant pain relief.
But what if those measures aren't providing enough relief? What happens then?
If those non-operative treatments aren't managing the pain effectively or allowing you to live your life the way you want to, then we start having the conversation about surgical options.
What kind of surgical options are available for someone with glenohumeral arthritis?
Well, for end-stage arthritis, where the joint is significantly damaged, total shoulder arthroplasty, or TSA, is often the way to go.
TSA, that's where you replace those damaged joint surfaces with artificial ones, right?
Exactly. And it can be incredibly effective in relieving pain and restoring function in folks dealing with severe arthritis.
You know, our listener mentioned a debate about hemiarthroplasty versus total shoulder arthroplasty. Can you remind us what the difference is between those two?
Sure. Hemiarthroplasty only replaces the ball of the shoulder joint, while total shoulder arthroplasty replaces both the ball and the socket. Traditionally, hemiarthroplasty was the go-to for younger, more active patients because it preserved more bone.
So it's seen as a more conservative option.
Yes, but we're learning more all the time. Recent studies have shown that TSA can be a good option even for younger, active individuals as long as the glenoid bone, the socket part of the joint, is in good condition.
So again, it really boils down to individualizing the treatment plan based on the specific needs of the patient.
Absolutely. We always take into account the patient's age, their activity level, the severity of their arthritis, and the quality of their glenoid bone when making that decision.
This has been quite a journey through the world of shoulder injuries. I think the main takeaway here is that there's no magic bullet, there's no one-size-fits-all solution, but there are options out there, and a good medical team can help you figure out the best course of action for your individual needs.
I completely agree. Knowledge is power, and now our listener has a much better understanding of these injuries, the different treatment options available, and hopefully feels empowered to have those conversations with their doctor to make the best decisions for their shoulder health.
We'll be right back after a quick break to delve a little deeper into this idea of glenohumeral arthritis and what it really means for getting back in the game. Welcome back to the deep dive. Before we move on, I want to go back to glenohumeral arthritis for a minute. It's a condition that can really bench you if you let it. So let's talk about how aging athletes can not only manage it, but also maybe even slow down its progression.
You're right. It's not something you want to ignore. And as we were saying before the break, glenohumeral arthritis, or osteoarthritis of the shoulder, is a wear and tear condition that affects the cartilage in the joint. Over time, that cartilage breaks down and you've got bone rubbing on bone, which causes pain, stiffness, and makes movement really difficult.
Oof, yeah, that doesn't sound like a good time. So where do you even begin? What can someone do if they're starting to have those symptoms of arthritis?
Well, the first line of defense, particularly for those in the mild to moderate stages of arthritis, is what we call non-operative management.
And what does that involve? What does that look like practically?
So we often recommend a combination of things. Activity modification, pain relievers, and physical therapy are the big ones. Modifying your activity to reduce stress on that shoulder is key. That might mean avoiding certain sports or exercises that tend to aggravate your symptoms.
I guess you got to listen to your body and adjust as needed.
Right, exactly. We might also suggest some over-the-counter pain relievers like ibuprofen or naproxen. They can help with both inflammation and pain. And physical therapy, that's a huge piece of the puzzle. It's all about strengthening the muscles surrounding the shoulder, improving flexibility, and maintaining that range of motion for as long as you can.
Now, you mentioned corticosteroid injections earlier. Are those something that are commonly used for glenohumeral arthritis?
We do use them, but we tend to think of them as more of a short-term solution for pain relief. Corticosteroid injections reduce inflammation in the joint, which can provide some much-needed relief, but they're not really addressing that underlying cartilage damage. And there's some concern that too many injections over time could actually have some negative effects on the joint.
Okay, so it's a bit of a balancing act. But what happens when those conservative measures just aren't cutting it anymore? You know, when the pain is still lingering and it's really starting to affect your quality of life?
Well, if non-operative treatments just aren't effectively managing the pain or allowing you to function the way you want, then that's when we start to have those conversations about surgical options.
So what kind of surgical options are we talking about when it comes to glenohumeral arthritis?
Well, for end-stage arthritis, when that joint is really significantly damaged, total shoulder arthroplasty, or TSA, is often what we recommend.
Right, we talked about TSA a little bit earlier. That's the procedure where you essentially replace the damaged joint surfaces with those artificial components.
That's it, and it can be a very effective procedure in terms of relieving pain and restoring function for folks who are struggling with severe arthritis.
Our listener specifically asked about the debate surrounding hemiarthroplasty versus total shoulder arthroplasty. Could you remind us what the difference is between those two procedures?
Sure, so hemiarthroplasty only replaces the ball of the shoulder joint, whereas total shoulder arthroplasty replaces both the ball and the socket. Traditionally, hemiarthroplasty was often the preferred choice for younger, more active patients because it preserved more bone.
So I guess in a way it was seen as a less drastic approach.
Oh, yes, but we're learning more and more as time goes on. Recent studies have shown that TSA can be a good option, even for those who are younger and more active, as long as the glenoid bone, that's the socket part of the joint, is in good shape.
So the bottom line is it comes down to looking at each individual case and making a decision that fits their specific needs and their specific situation.
Exactly. We always look at things like the patient's age, their activity level, how severe the arthritis is, and the quality of their glenoid bone when making that decision.
Okay, now let's switch gears a bit and talk about something that we often don't talk about nearly enough, the mental and emotional side of recovering from a shoulder injury. I mean, you've dedicated so much time and energy to your sport, and suddenly you're sidelined. That's got to be tough, right?
It's a really big adjustment, and you're right, it's something we should be talking about a lot more. We focus so much on the physical part of recovery, but the mental and emotional toll can be just as challenging. Athletes who are recovering from a shoulder injury, they often experience a whole range of emotions: frustration, disappointment, sometimes even fear. Fear that they might not be able to get back to doing what they love.
I imagine it's almost like you're losing a part of yourself, losing a part of your identity. What advice would you give to our listeners who are going through this? How can they stay positive and motivated during that recovery process?
The most important thing is to acknowledge those feelings. Don't try to bury them or pretend they're not there. It's okay to feel frustrated. It's okay to grieve the loss of that routine that was such a big part of your life. Talk about it. Talk to your doctor, talk to a therapist, talk to your coach, connect with other athletes who've been through similar experiences. You're not in this alone.
That's such an important message. Just knowing that you're not alone in this struggle can make such a difference.
Absolutely, and setting realistic goals is so important. Don't compare your recovery to anyone else's. Everyone's journey is unique. Focus on the things that you can control. Show up for those physical therapy appointments. Stick to your home exercise program. Find activities that you can do that don't put too much stress on your shoulder, and celebrate those small victories along the way.
So it's about shifting that mindset a little bit. Instead of dwelling on what you can't do, focus on what you can do to support your healing and get back to what you love.
Exactly. And remember, recovery, it isn't always a straight line. There will be good days and bad days. Just be kind to yourself. Listen to what your body is telling you, and don't be afraid to adjust your goals as you go. But the most important thing is to keep that vision in mind, that vision of yourself back in the game, stronger and more resilient than ever.
I love that. And as we're wrapping up this section on glenohumeral arthritis, I keep coming back to that idea of individualized care that you mentioned earlier.
It really is the foundation of everything we do. There's just no one-size-fits-all approach to treating shoulder injuries, especially in aging athletes. Our listener has done such a great job of gathering all of this information, all these sources and diagrams and research, but now it's about taking that knowledge and applying it to their unique situation, working with their healthcare team to create a plan that truly aligns with their goals and their values.
Okay, so now that we've covered the physical and emotional aspects of these injuries, let's talk about something that's often overlooked but can be a game changer: preventative measures. What can aging athletes do to protect their shoulders and reduce the risk of these injuries in the first place?
That's a great question, and it's never too early to start thinking about prevention. One of the most important things is to warm up properly before any activity. I know it sounds basic, but you'd be surprised how many people skip this crucial step.
You're so right. A good warm-up gets those muscles ready for action and helps improve flexibility and range of motion, which can definitely reduce the risk of injury.
Exactly, and equally important is using proper technique during your workouts or when you're playing your sport. Poor form puts unnecessary stress on those joints, which can lead to all sorts of problems down the road.
So make sure you're working with a qualified coach or trainer who can help you dial in that technique.
Absolutely. And don't forget about strength training. Building strong shoulder muscles is crucial for stability and injury prevention. We're not talking about lifting super heavy weights here. It's more about focusing on those rotator cuff muscles and the muscles that surround the shoulder blade.
So those targeted exercises that help stabilize the shoulder joint.
Right. And just like we talked about warming up, Cooling down after exercise is also key. Stretching those muscles after a workout helps to improve flexibility and prevent tightness, which can also contribute to shoulder problems.
And I imagine listening to your body and taking rest days when needed is also really important, right?
You know it. Pushing yourself too hard without giving your body a chance to recover can backfire big time. Rest and recovery are just as important as the actual workout.
So true. It's all about finding that balance between pushing yourself and knowing when to back off a bit.
Exactly. And something else that aging athletes might want to consider is incorporating activities that are a little bit easier on the joints, like swimming or cycling. They can be great ways to stay active and maintain fitness without putting as much stress on those shoulders.
I love that idea. There are so many ways to stay active and keep moving without putting your body at risk.
Absolutely. And another thing that aging athletes should pay attention to is their posture. You'd be surprised how much poor posture can contribute to shoulder pain and dysfunction. So make sure you're sitting up straight, keeping those shoulders back and down, and avoiding those hunched over positions that can wreak havoc on your body.
Good posture is so important for overall health, not just for your shoulders.
You got it. And if you're experiencing any shoulder pain or discomfort, don't just brush it off. See a doctor or a physical therapist to get it checked out. Early diagnosis and treatment are key to preventing those minor aches and pains from turning into something more serious down the line.
Excellent advice.
Yeah.
It's always better to be safe than sorry. Well, this deep dive has been incredibly informative. I feel like we've covered so much ground today.
It's been a pleasure sharing this information with you and our listeners. Hopefully everyone feels a little more knowledgeable and empowered to take charge of their shoulder health.
Absolutely. So to our listeners, if you're an aging athlete dealing with shoulder pain, or if you just want to be proactive about protecting your shoulders, remember that knowledge is power. Keep learning, keep asking questions, and work with your healthcare providers to create a plan that's right for you. And until next time, keep diving deep. As we've been talking about all these different shoulder injuries and the treatments, it's really hit me that aging athletes are facing this, unique challenge, right?
Yeah.
You've got the experience, the knowledge of your sport, but your body might not always be on the same page.
It's such a delicate balance, isn't it? And I think that's what makes this deep dive so valuable. Hopefully our listener feels equipped to make those informed decisions about their shoulder health and what they want their athletic future to look like. They've got all these sources, the diagrams, the research, and now they've got this framework to put it all together.
Exactly. So let's shift gears for a minute and talk about something we often don't address enough. The mental game of recovering from a shoulder injury. You've dedicated so much time, so much energy to your sport, and then boom, you're sidelined. How do you even process that emotionally?
It's a big adjustment, no doubt. The physical challenges are obvious, but the mental and emotional toll can be just as heavy. Athletes dealing with shoulder injuries often experience frustration, disappointment, even fear that they might not be able to get back to doing what they love.
It's almost like losing a piece of yourself. So what advice do you have for our listener who might be going through this? How do you stay positive? How do you stay motivated during that recovery?
First of all, acknowledge those feelings. Don't bottle them up or pretend they're not there. It's okay to be frustrated. It's okay to grieve the loss of that routine, that part of your life. Talk about it. Talk to your doctor, a therapist, your coach. Connect with other athletes who've been there. You are not alone.
Sharing those struggles, knowing you're not alone, can be so powerful. What about setting goals during recovery?
Setting realistic goals is absolutely key. Don't compare your recovery to anyone else's. Focus on what you can control. Showing up for your physical therapy, sticking to your home exercises, finding activities you can do that don't stress your shoulder. Celebrate those small wins.
It's about focusing on what you can do, not what you can't.
Exactly. And remember, recovery isn't always a straight line. You'll have good days, you'll have bad days. Be kind to yourself, listen to your body. Don't be afraid to adjust your goals if you need to, but most importantly, keep that vision in mind. That vision of yourself back in the game, stronger than ever.
I love that. And as we wrap up this deep dive into shoulder injuries and aging athletes, I think the biggest takeaway is that there's no cookie-cutter approach. It's about individualized care.
Couldn't agree more. Our listener now has all this incredible information from all their research, but it's about taking that knowledge and working with their healthcare team to create a plan that really works for them, for their needs, and for their goals.
Exactly. And that brings us to our final thought for you today. As you continue on this journey back to your sport, we want you to ask yourself, what does peak performance mean to me now? Is it about pushing your absolute limits, setting new records? Or is it about something a little deeper? The joy of movement, connecting with your teammates, the satisfaction of staying active and engaged in something you love, whatever it is, hold on to that vision. Let it fuel your recovery. Remember, the power to define your athletic future, that's in your hands.
Beautifully said. It's been a pleasure diving deep into this topic with you.
And to our listeners, until next time, keep diving deep.